Hello, welcome to prostatevideos.com. I'm Dr. Gerald Chodak. In this video, I want to talk about what is known about the prevention of prostate cancer. Prostate cancer can be prevented. There has been two good studies. One using a drug called Finasteride. That drug is available for the treatment of men that have urinary complaints. It works by shrinking the prostate. In a well-done study, men were assigned to receive finasteride or a placebo, and after a number of years on the drug, they then were suggested to undergo a prostate biopsy. The study found that 1 out of every 18 men taking the drug for about 6 years was able to avoid being diagnosed with prostate cancer. So it reduced the detection rate by about 6% of the population that was tested. And many people are suggesting that men certainly be offered this drug as a way to avoid getting diagnosed with the disease. Another study was done with a similar drug called dutasteride. That's also approved for the treatment of men that have urinary complaints, and it also shrinks the prostate. In the dutasteride study, men that had a previous negative biopsy of their prostate were assigned to receive either dutasteride or a placebo. And 4 years later, they were then subjected to a prostate biopsy. This study found about a 5% reduction in the detection of the disease, which means that about 1 out of 20 men benefited by taking the drug. There are some concerns that perhaps some of the cancers that eventually got detected might be more aggressive. But for the moment, the side effects are very low with these two drugs. And for men that want to do whatever is possible to reduce the risk of getting diagnosed with the disease, we now have two things to offer them. Finasteride if they've never had a problem before, and dutasteride if they've had a previously negative biopsy. Now, another study was done looking at the ability of vitamin E and selenium, two over-the-counter agents, to see whether they could prevent prostate cancer. So men were assigned to one of 4 groups. They either got vitamin E alone plus a placebo, they got selenium plus a placebo, they got vitamin E and selenium, or they received 2 placebos. And the study found that there was absolutely no ability of the vitamin E and or the selenium taken alone or together in being able to reduce the detection of prostate cancer. This is important to realize because many herbs and supplements are thought to be very helpful. And unless they're tested in a properly controlled trial, we really can never say whether they work or they don't. Interestingly, in this vitamin E and selenium study, there was a slightly higher incidence of diabetes in the men getting selenium. So the issue remains whether or not you should take supplements to prevent prostate cancer or not. This study would say that so far there's no evidence of a benefit. But the bottom line here is, for men that are interested, there are things that they can do to reduce the risk of getting prostate cancer. Hopefully you will find this information useful. Thank you.